I am Dr. Kaliselvi Xavier, Professor in Tribhulam College of Nursing. The objectives of the class: explain the breathing process, mention about brain and oxygen, enumerate the respiratory emergencies, what are the first aid, explain the respiratory distress, and what is the role of the nurse and complication. What is the breathing process? Air into the nose and mouth passes through pharynx. It will be travel through the trachea, lungs, blood, delivery to the brain, organs, muscles. It is anatomy and physiology of the respiratory system. Where the brain and oxygen. Brain is very sensitive to oxygen starvations, where the brain cell starts to die in 4 to 6 minutes without oxygen. What's the time frame for 0 minutes? Breathing stops, heart will soon stop beating. So 4 to 6 minutes brain damage possible. 6 to 10 minutes brain damage likely over. 10 minutes irreversible brain damage certain cannot be happen. What is breathing? Brain controls breathing. It will adjust rate and depth of breath based on oxygen and carbon dioxide levels. It also requires respiratory, circulatory, nervous and musculoskeletal system to work together. Now we'll see what is respiratory distress. It is a most common type of breathing emergency injury, illness, excitement, anxiety. What are the signs and symptoms? Obvious: cannot catch their breath or gasp for air, grunting, wheezing, gurgling, shrill sounds, breaths unnecessarily fast, slow, deep or shallow, slow less than 8 breaths per minute. What is the signs and symptoms of respiratory distress? The skin unusually moist and flushed, pale, ashen or bluish, cyanosis can see. Symptoms: dizzy, lightheaded, painful, tingling in lips, hands. What are the other specific types of respiratory distress? Asthma, emphysema, hyperventilation, and anaphylaxis. What are the care for respiratory distress? Initial assessment, summons emergencies. Helps the victim rest comfortably. We have to do the physical examination properly, sample the history immediately, reassess the victim, assist with the medications, monitor vital signs. Then what is respiratory arrest? Breathing stops, illness, injury, obstructed airway, where the heart will stop beating, organs will begin to fail. Then what is rescue breathing? Breathing air into the persons to supply him or her with the oxygen needed to survive. What are the steps determine the loss of consciousness? Unresponsive. We have we have to open the airway and look, listen, feel for breathing. No breathing, give 2 slow breaths. Check for pulse, look for severe. Then rescue breathing. Keep airway open, 1 breath every 5 seconds. Every minute recheck. When to stop rescue breathing? Victim breathes on own, victim has no pulse. CPR someone with more training than you arrives. You are too exhausted to continue. The scene becomes unsafe. What are the special consideration? Air in stomach vomiting, mouth to nose breathing, mouth to stoma breathing, victims with dentures, suspected spinal injury. Where the infants and children's faster breath rate and pulse rate than adults. So rescue breaths are faster, less air in each breath. Head tilt is less, cover mouth and nose infants. So 1 breath every 3 seconds. The children's 1 breath every 5 seconds. Most common cause of respiratory emergency, airway obstruction, most common cause of respiratory emergency. The two causes, anatomical or mechanical, partial or complete. Partial airway obstruction can still move some air in and out of the lungs. The person can still cough and or speak. The person may clutch throat, universal sign. Encourage them to keep coughing and summon emergency if it's continuous. Then complete airway obstruction, unable to speak, cough, cry or breath, call emergency immediately. Heimlich maneuver or abdominal thrust until the obstruction is clear or they become unconscious. If unconscious choking adult or child, lay the person down, open the airway by lifting the jaw up, fingers sweep, open the airway, head tilt and chin lift. Give 2 slow breaths. If air does not go in, reposition, retilt the head. If air still does not go in, give up to 5 abdominal thrusts or chest thrusts. Do a finger sweep. Give 2 slow breaths, reposition if necessary, repeat until object is hit. Chest thrusts, middle of the sternum. Person is too large or they are pregnant, compress only 1.5 to 2 inches, 5 quick thrusts. If the patient is conscious choking infant, call emergency number, alternate 5 back blows and 5 chest thrusts until the object comes out. The role of the nurse, first aid, sometimes referred to as emergency aid, is the first skilled assistance given to the victim on the occurrence of the accident or sudden illness in order to preserve life, prevent further injury and relieve suffering until medical persons reached. The complication, only by improving knowledge of first aid procedures can an increase in the efficiency of the emergency measures to attained, as will be proven in the PIS paper. Intensive schooling is necessary not only for the laymen and the ambulance orderlies but for doctors who are to be employed in rescue work in particular. The present criteria, 1 year clinical activity and competency are by no means foundations. Thank you. These are all the references.